Hi everyone. So I know all of you because by the virtue of citizenship of India, we first look at NEET PG as the option for doctors whenever we want to prepare further, we want to qualify further. But there are huge opportunities for Indian doctors in America and in UK. And today I have with me in this show today one of the person who knows most about USMLE in the entire country, and Dr. Shubhank, who leads the UK wing in the DAMS academic program. So Dr. Mala and Dr. Shubhank will enlighten us today about life in US and UK, opportunities for doctors, exam, and how to go about it, and what are the programs that we are offering. So I'd like to start from Dr. Mala, and I personally vouch for it. Many years of my association with Dr. Mala, I've seen that many students come to me and they say that whatever they could find out about USMLE in maybe 3 months, in 3 minutes of talking to her, they get to know. So, Dr. Mala, tell us more about yourself and why you are into USMLE mentoring, and also tell us what should they expect out of US.
So thank you so much, Dr. Sumer, for this wonderful introduction, as well as an opportunity to connect with students over the last decade that I have been working with DAMS and with Dr. Sumer. We've had multiple opportunities to talk to students. I think the first step to go make a decision for yourself is knowing what you're doing. If you have an idea what is NEET PG, what is USMLE, what does it entail, then making a decision becomes easier. So I think what you are doing is really good, because at every step in life you are advising students as to what are the different things, whether it is finance, whether it is life in US, or whether it is exactly how difficult it is, because most of the time today it is a media, which is I think a plus point to be on the social media all the time and find out things. But the negative part I have seen a lot. Most students come to me and say, ma'am, USMLE बहुत महंगा है, वहाँ सर्जरी नहीं मिलती है, या फिर so many things which are actually not true, that Indians are not treated very well in the US, and myths like this. So I think if we just to give you a short idea, USMLE is taken by all medical graduates all over the world who want to go and practice or do medicine in the US. So if you want to do an MD in the US, you have to complete all the steps of USMLE. If you want to do fellowship also, you need to complete steps of USMLE. What is an ideal time to do it? A second year student is the most ideal person to give, start studying for USMLE, and third year is the first time you can actually give the USMLE exam. And of course there are 3 steps for it. First step is step 1, which is taken in the third year. Second step is taken in your internship year, because you have to be you should have finished your final year to take your second step. And the third step for the time being is OET. Initially CS, it used to be CS, which has now been abolished after COVID. So now the third step is an OET, which is an English language like a TOEFL exam. And once you clear all the steps and you have your MBBS degree, you can apply for a residency. This is the basic this is what the students usually do. Now the cost for the whole thing, the exams are probably as costly as any other exams. The studying for the exam is also almost as much as they would do for any other exam. What really actually makes the cost very high is to go to the US and gain clinical experience, because very importantly, other than just doing your exams, you have to get letters of recommendation from the US, and that letter is only availed once you travel to the US and get some letters from there. How do you get those letters? I think in a very detailed videos, we have multiple videos from DAMS where we have talked time and again about how you travel to the US, how do you apply for those rotations, and we'll keep doing those videos. But the fact is, you need to complete your 3 steps, go to the US, gain your experience, and with your MBBS degree, get a job there. And I would say the cost should be anywhere between 10 to 15 lakhs. That's a very small ballpark figure is what I can say. इसमें बहुत ज़्यादा भी आप कर सकते हो. If the stay, the travel, and also where you work, like if you go to Harvard, Yale, or some big names like that, वो बहुत महंगे भी होते हैं, पर ज़रूरी नहीं कि वो सबसे अच्छे हैं. So this is what it is. I think you asked me life in US, of course. I would say that life, it depends on what you want in life. Frankly, if you're looking for a nice house, a good car to drive in, good roads, maybe, no pollution, because we are sitting in a highly polluted city. I love this city. But at the end of the day, there are many people who say, no, this is not the place I want to stay. Then obviously life there is better. You get a lot of money there, because doctors are probably the second highest paid professionals after lawyers. So paisa bhi hai, and the life is much better there. What you miss there probably is your home and your mom's haath ka khana, but other than that, I think life in US is definitely good. Opportunities for fellowship and studying beyond your MD is definitely more exciting, interesting, and easier to avail. So I think that answers most of your questions.
I think, as I said, 3 minutes with madam is enough now, and I would request the listeners to pause it, rewind it, listen to it multiple times. Everything that you need to know about USMLE is actually there in your 3 minutes.
Thank you so
And
much.
now I'll ask Dr. Shubhank. Dr. Shubhank, tell us about, Dr. Shubhank, you're going to join in Wales now in UK, and I want to know from you what attracted to you to UK. What is it that you are looking for in a life as a doctor in UK? And you are also an educator, you are also a leading part of the program of DAMS PLAB program, and you are also an educator in PLAB 2 program also. So what is it that drives you to UK, and why do you think it is important for Indian graduates to know it right now?
Right. So thank you so much for giving this opportunity. It's indeed a pleasure to sit across Dr. Sumer Sethi. I always say, in a candid way, he is the Amitabh Bachchan of medical education in India, for the phenomenal work he has done to revolutionize this whole industry of medical education. But because what we used to see in medical college is very boring kind of teaching and sort of things, but literally with his lectures and his dedication and team, we could see amazing results, and students are actually enjoying doing this tutoring part after their medical school, etc. So that is really fascinating. So I would say, London for me is a city of dreams that really excites me, even when I have a thought of, going to London. So that really makes me feel like every cell of my body is there in London. Yeah, that music, that food, that colors. And there is a perfect work-life balance in the UK, I would say. In terms of salary you get is definitely much higher than the home country. I won't say like which is bad, which is good, but it really depends on your own liking towards any particular country. So I would say there is a very good thing about interpersonal communication. What I really like about working in the NHS is the amount of time you give to patients. The eye contact, listening to their problems, breaking bad news, if a patient or attendant is angry. So I have worked in a corporate hospital in India, and I have realized the biggest problem as a doctor we face is communication. So this country really helps me to make me feel, a good doctor, a doctor who could really listen to the patient and calmly, answer all their queries and make them involved in the treatment process. Sometimes it happens that as a doctor we try to present like this is chemotherapy for you, this is surgery for you, etc., etc. And you don't understand the real why, in the patient's heart. So NHS gives me this opportunity where I could involve my patients into whatever treatment options they have, whether they want resuscitation for them, whether they want invasive lines, ventilation, etc. They have the right to refuse, they have the right to accept, and all these services are free for them. I understand there is waiting, but this is something amazing for me that patient has the proper GP follow-up, all their history, medical allergy, etc. is documented well, and for every budding doctor there is a hero. So for my I worked with a very famous doctor here in India, Dr. Prasad Rao. So he was my hero. He did MRCP in the UK, he worked in a lot of hospitals in London. So that really excites me when I started my journey in India as a doctor. So his whole way of seeing patients, diagnosing their problems, explaining their concerns. Sometimes as a junior doctor we used to get irritated and say, sir, this attendant is asking too many questions. Then very calmly with his beautiful smile he used to handle that. So I would say that really is very important, and that really makes you reach whichever destination you want to, if you have seen such sort of mentor for you. So I would say UK definitely is very good country. Even being a MBBS doctor, you have a lot of opportunities to work in different departments. You always have a career path where your clinical and educational supervisors are involved with you. They help you to become a consultant through different routes they have, and you can always do Royal College exams, PLAB exams. We run a wonderful academy and courses here, and you really feel that it is worth living this life of a doctor. I know sometimes when we keep money in mind, we compare like US, you are paid more, Australia you are paid more, but everything in life has a right time, The way you treat patients when you learn this in the UK, probably after a year or two when you go to Australia, you are paid double than what you are getting. But this amazing experience of, feeling this life of a doctor, somebody who really cares, that gives me, a charge in life, a motivation in life, and that's how, I started my journey in the UK, and I'm really blessed to be a doctor in the NHS.
So now Shubhank, now I have some questions for you which I want you to give maybe a one-line answer to. Number one, how many months should someone prepare for PLAB 1?
So I would say first step is English. After you pass your English, for PLAB 1 you should have roughly 6 weeks, which should be sufficient for doing the questions, practicing these questions. Usually there are fixed 3000 around questions in different apps available. DAMS has a beautiful app, I should say, where there are 3000 plus Q-Banks questions which are answered by the experts, and I think that is sufficient 6 weeks.
So maximum somebody should keep around 2 months.
Yeah.
Okay, number 2 question is, what is the band or in English, or what is it desirable for a doctor, and what do you think, is that a trouble for some people who might be studying in periphery, or some doctors who are from Hindi medium school? Does that affect?
I would say, yeah, you have to give a exam of spoken English, because ultimately you are going to talk to the native patients. Patients can't change their English for you. You have to adapt to it. You all know how to speak that English, but their English may be having a different accent, bottle of water or that really makes this thing. So this exam really helps you. Don't think that this exam is an obstacle. Think that this exam is really going to help you to have better communication with your colleagues and your patients, and you need in OAT B in all listening, reading, speaking, writing section. In IELTS you need minimum 7 in all these sections, and overall 7.5 score, which is easy to get. The key is practice.
And about PLAB 2, how difficult it is, and it is conducted on SimMan and Mannequins, and you have seen the DAM setup also.
Yeah.
So how do you've seen the exams being conducted there. How do you feel, the difficulty level for Indian doctors, and do you think we are up to the mark in the DAMS courses?
So definitely we will say that we have already, we are beyond expectation. The sort of academy, the beautiful infrastructure we have. DAMS is a platform where you have like 250 plus center across the country, and it's not only Indian students studying, lot of students from different Asian medical colleges are part of it, and DAMS is supporting them in, throughout their journey. And there is no bias that you are only focusing NEET PG or USMLE or PLAB. This is something amazing for medical students, which excites me also, that we have a menu card for them and they can choose what they want to, and we are supportive in their dreams. So I would say DAMS has perfect, setup. All the SimMans, Mannequins, everything is available. Best of the thing is that we are here to support you and, do proper hand holding to guide you at every step. And I would say, in comparison to NEET PG, USMLE, this is the most simplest exam. These are, the clinical scenarios which as a junior doctor. Your knowledge is assessed at the level of junior doctor. You are expected to know the common thing, not the rarest of rare. So that really makes this exam very exciting exam all over the globe. And junior doctors, just after their primary medical education, want to go to the UK, because they know, whatever knowledge they have gained during internship is going to help them in passing the exam.
And one final question before I ask Dr. Mala the same questions is, how much does a doctor earn in UK when he enters, and after 3 years and after 5 years, what is the kind of money they can earn?
Right. So immediately when you pass your MBBS and internship, you join the UK system. As a junior doctor in the NHS, you are paid roughly like, your band starts from 32,000 pounds, that is around 32 lakh rupees annually. And depending upon your experience, it can go up to like 40,000 pounds a year. If you already have experience in your home country, you have worked for a year or two, or you have done your post-graduation, so that is going to add to your experience. So you can even, start with 50,000 pounds or so, that is around 50 lakh rupees annually. It's a good amount. This is just for 40 hours per week. Other than that, when you work out of social hours in the evening, on bank holidays, on Sundays, you get a lot of those opportunities, and locum. So you can gain, almost double of it. Also, if you are hardworking and, using these hours.
So Dr. Mala, now I have some one-liners for you as well.
Sure.
So how many months should someone prepare for step 1 USMLE?
All right. So, although it's a one-liner, I just need to tell you, step 1 has now become a pass and fail exam, because of which the length of study literally has come down, because initially it was competitive. So, I would say anywhere between 6 to 7 months is optimum and good enough for a person to give the exam.
Second question is that has the exam become more difficult after it has become pass and fail step 1?
Yes, I would say yes, because there have been cases where students have taken it a little lightly and they have not been able to clear the exam. So I still feel, even if the exam is pass and fail, making sure that you clear the exam and studying hard, taking help is definitely important.
And how long is the DAMS program for step 1?
So we have a 6-month program, and we believe that if they want hand-holding, we give it up to a year for students starting second year, which is the ideal time for them to join the program.
And what is it that, what should be an ideal score in step 2 CK, and how long should they prepare for step 2 CK?
Again, step 2 CK, if you do step 1 well, is a very 4 to 5 months process if you have really done well in your step 1. So taking help from DAMS and then going on to step 2 CK is just question banks. Another 5 to 6 months is good enough. Getting a 250 plus score puts you easily in a league of getting more interviews. Even now our students are interviewing. Most of them who have got very high scores are the ones who have got maximum number of interviews. So 250 plus is a good score.
And what percentage of IMGs truly match into the residencies?
It's become 60 now. When I started, that was almost 20 years back, it was as low as 30 to 40%, and now it's become 60%. So it's only increasing. Number of students getting through from the IMG category is gone up to 60%.
So if you put it into numbers, it will be like out of 3 candidates, 2 are getting selected.
Absolutely, correct.
Is there any residency which is more competitive than others?
Yes, all the surgical branches are more competitive. But radiology used to be at one point very competitive, but these days a good number of IMGs are getting into radio. And the plastic surgery, neurosurgery, all the surgical categories, gynecology, obstetrics, they are a little more urology. These are all most competitive. Ortho, things like that. But the internal medicine, neurology, pathology, radiotherapy, these kind of branches are easier to get for international students.
And finally, the same question that I'll ask is that how much do you get paid during residency, and how much do you get paid after that, and what is the kind of money that they can look at?
Yeah, so that's a very good question. Usually they start the residency with as low, they call it very low pay, which is $60,000 per annum, which is not bad, but according, they have to stay and work and everything. But as they finish their residency, the job package starts from $200,000 until even $600,000 to $700,000. That is over $30,000-$40,000 a month, which is a lot of money.
It sounds good to me.
Sounds good, right?
I am already thinking in terms of dollar and pound.
Yeah.
So if you are thinking in these lines, and if you are looking for lifestyle, clinical work, communication, counseling skills, fellowships, sub-specialization, you have to think beyond the country where you have been born at. We are not trees, we have to look beyond. And we have to see every opportunity that is coming our way, weigh it, and then decide what is it that works out for me. At DAMS, we don't judge you at the choices that you make, and we don't, we are not biased like Dr. Shubhank said. We have courses for NEET PG, definitely you know us, but we have courses for PLAB also and USMLE also. And any queries for the experts, please feel free to put them in the comments or reach out to us. I think, this is initial part of the series that I will be doing with these experts, and I will be coming back with more and more information. But I already know for sure that in this single episode, the information that you have got already is much more than you can find out by talking to hundreds of your seniors.
Absolutely.
And that is what we want to do. We want to accelerate your process. We want to make sure that we are able to help you to achieve it faster. So on this note, I thank both the guests for their inputs. And any final words from your side, Dr. Mala?
Yeah, so I just want to say, Dr. Sumer is right. Please don't get biased by what you see, on the online and so many other rumors that are there about USMLE specifically. We will put on the bio all our details on how you can connect with us. Make sure that you check out the link. And I would just say all the best. Whatever decision you have to make it after complete information. Don't just jump into rumors and take a wrong decision. We are here to support you in every which way, and all the best in your journey.
And Dr. Shubhank, any final words from your side?
So I would definitely say the best part at DAMS is it's not just to appreciate you here, I'm sitting across you, is the proper hand holding. I could see a lot of Dr. Sumer Sethi like a celebrity, always with students, lot of students coming to his office, is interacting. So I think this is very amazing, is hand holding. And that's the reason I also thought of joining hands with DAMS, because the proper hand holding given here is to make better version of you. You are already a doctor, you are already self-motivated, you have already finished your MBBS, but what DAMS is giving you is to make out a best version of you. I would like to conclude by saying, and I am very fond of these lines of Dr. Sumer Sethi, is अपना टाइम अपन खुद ही बनाएगा, यही समय है, सही समय है.
और अपना टाइम अपन खुद लाएगा, चाहे इंडिया में लाए, चाहे यूएस में लाए, चाहे यूके में लाए, चाहे डॉलर में लाए, चाहे पाउंड में लाए, लाएगा अपन खुद. थैंक यू वेरी मच एंड आई लुक फॉरवर्ड टू हैविंग यू अगेन ऑन दिस कॉल.